Microphone. I hope the right microphone is on. Okay, looks like it is. It's not the best microphone, but it does the trick.
MEL Med.
MEL Med. Put it. No, everywhere. Anywhere we go, they can see it. Spoiler alert! There. I can still see it. There we go. Now it's like a reflector. Let's wait for some friends to get on. Elizabeth, sup?
Hey, Elizabeth. Hey, Kristen. Hey, Angela.
Hey, Sharon. Hi, Terry. Arlene says, hello, Anna and Nana. Do.
Hey, Arlene. Do.
Good afternoon.
Kaylee says, hi,
Therese. Quiet on the set.
We're playing a commercial on the live.
Oh, Aaron's getting ads. That's always good.
Yeah.
Hello, Pete. Hello, Marilyn. Hello, Lori. How are you guys today?
Hi. Connie says, hi from Michigan. Hi from Michigan.
How is
Cool.
everybody's Tuesday going? Terrific Tuesday? Or terrible Tuesday? Or a tumultuous Tuesday?
What's
Dun,
that?
dun, dun. Tumultuous means like crazy, like up and down. It's crazy. It's good. It's bad. It's good. It's bad. Think of another T word. How could we describe Tuesday? A tip-top Tuesday.
What does that mean?
Like tip-top, like the best of the best. A
Snowy Tuesday.
That's not a T word. Think of a T word.
No, that's what somebody said, though.
Think of a T word. Help me.
Terrific Taco Tuesday.
Terrific Taco Tuesday. Ooh, we're making tacos tonight too. It is Taco Tuesday. No pico this week though.
Terrible.
What else? Let's think of a different one. Theatrical Tuesday. Therapy Tuesday.
Oh, yeah.
It's about to be a therapy Tuesday. Topsy-turvy. Ooh, I like that one, Angela. Topsy-turvy Tuesday. Hello.
Taco Tuesday.
Trying to keep it Terrific Tuesday, but have to stay away from posts. Certain posts. Yes. Tumultuous Tuesday. Yes.
Tiresome.
Tiresome Tuesday. That's a good one from Aaron.
What is that one?
It has been a little bit tiresome. I've been working all day.
What does that mean?
Tiresome? What do you think tiresome means?
Tired?
Yeah, like it makes you tired.
Well, how about tranquil?
Tranquil Tuesday. Ooh. Oh, look. Who said that? Lori said Troublemaker Tuesday. Are you a troublemaker?
Maybe.
Thundering. Ooh, who's having a thundering Tuesday?
Trumpet Tuesday?
A typical Tuesday. A trumpet Tuesday. A typical Tuesday. Yeah, it's Tuesday. Well, thank you guys for
A Tuesday?
thank you guys for hanging out with us on this Tuesday.
Susan says a Talking Tuesday.
A talking Tuesday. Yep, that's what I'm doing, talking. Thanks for coming on and
TV Tuesday?
it's a thankful Tuesday.
Huh?
Thank you for coming on and spending time with us. Thank you for sharing this live stream.
Tip Top Tuesday?
Thank you for putting up with the ads.
Thirsty Tuesday?
Thirsty. Ooh, I'm thirsty.
I'm thirsty.
Okay. Now it's a topped off Tuesday. Should we get started?
Yeah.
We've got a big kit here today. This is a therapy kit by MEL Med. We are going to check it out.
I pushed it exactly when we said that. Can I push it out?
Do you want to read on the back what some of the activities are?
Thermometry, pulse oximetry.
We did not go over these before the live. This is I was testing her.
measuring blood pressure, goniometry, association of the heart, and association of the lungs.
Wait a minute. Is that right? Now, I'm not a medical professional, but I know that some of you are. Is this word actually association? Did she say that correctly? Because if so, she shocks me all the time still. It is spelled, AUSCULTATION. Association, is that correct?
I think so.
I'm waiting to hear from. I know one of you guys are nurses. One of you guys is a nurse. Yes. Barb says yes. Tammy says yes, ma'am. Joanne says nope.
Yes, it is.
No, close. Okay, so can someone spell it out for us phonetically so we know the proper way to say it? Help, please. Shirley says she's right.
Everyone's saying yes.
Means hearing, as in listening to breath sounds. That makes sense, of the heart, of the lungs. But the question is, how do we pronounce it properly?
Association.
Auscultation?
Yeah,
auscultation. I see it. Auscultation. Thank you, guys. Okay, try again.
Auscultation of the heart and auscultation of the lungs.
Thank you. See,
So
this is why.
Can I read what we need?
This is why it's great to have smart friends online with us, huh?
Yes. So here we've got this medical set contains goniometer for the goniometry, badge holder, badge pocket, card holder, case history, nitrile gloves, MEL.
Get the app to start. I have to get the app to start?
Huh.
I have to use an app for this?
Measuring tape, set of cards.
The safety manual.
What did you just throw that on the floor?
We don't need that. Oh, this is interesting.
You want that?
No, it's like a general, don't shove things in your eyeball, don't start any fires, protect your eye. Yeah, it's,
We don't need that.
Some people might need it, but I think we're okay. Oh, look, they put it all in a little bag.
Oh, yeah, that's
Very
and it says
cute.
be well with an 8 heart on it.
Like a medical bag.
Yeah.
Mm-hmm. Wow, there's a lot of doodads in here. A lot of doohickeys and doodads and stuff. Thingamabobs and such.
Thingamabobs.
Uh-huh. You want thingamabobs? I have 20. But who cares? No big deal. I think the directions are on here.
I want more.
I want non-app directions, but apparently that's not happening. So let's look it up.
There's a stethoscope. There's a thing that goes on your finger when your blood pressure or your heart gets too high.
Your heart rate?
Yeah.
That's a pulse oximeter, right?
Yeah.
All right, let's see. I need to scan that thing right there. Let's do that. That's this guy.
Michael says, you don't need a safety manual. You have a therapy kit.
Dr. Anna needs her medical supplies.
I've got a real sense.
Okay, we're going to install this app. And hopefully it brings us lots of joy.
No.
Debbie says, this is us Tuesday.
Yes, this is us Tuesday. Fantastic one. Thank you for the reminder.
Open.
Very excited as usual. Okay, open.
I like that shows that at the beginning.
Oh, we're meeting Mark right now. This is Mark. Swipe left. Sign in. Oh, now we have to create an account. Okay, let's do this real quick.
What should we call it? What
Um,
should the email be? Regular.
probably our email. Probably not their email. I think we want to use our email. Let's do that. And now we have to enter the code that has come by email, of course.
What is it?
It's our secret code. We don't say. Sign in by code. Okay. Ooh, animated instructions. Okay, that's cool. Take a picture and send it to. They're collecting data. Okay. I'm okay with that. Virtual reality lessons. I don't think we have the
I need
headset for that. You need that? Okay, let's get started.
My MEL.
Yeah, let's get started. Okay, we are doing.
Therapy.
No, this is not the right kit. We gotta find our other kit. Here we go. Patient. Oh, look at there's all the meet and diagnose your first patient. Wow. Are you going to test these things on me?
Yeah.
Internship part 1. Your first steps as a physician. You ready? Let's check it out. Start experiment. Okay. It says, welcome to your virtual internship at MEL Hospital. We'll start your training with the basics, such as taking a patient's medical history. Every doctor should be able to do this. In the future, you'll try your hand at surgery, cardiology, dentistry, and other areas of medicine.
Hello. Today we'll start with the basic skills that you will need when communicating with a patient and taking their medical history. It is important to ask accurate questions and correctly interpret the patient's answers. It's not just what you tell the patient that's important, but also how you do it.
So it says today we're starting with the basic skills. We recommend taking notes to remember everything.
Let's look at the most important steps in preparing a medical history. First of all, introduce yourself to the patient. Then ask if the patient is okay with you taking notes.
So first you introduce yourself to the patient. So you say,
I would say like, hello, mommy.
mm-hmm.
And then my name is Anna.
Dr. Anna.
Yeah, my name is Dr. Anna. And then what should I say for that one?
Specify your specialty. What do you specialize in? I am a joy doctor.
Yeah, I'm a joy doctor. Can you write those in there?
No, but you can use that to say. See? Hello, Mr. Wong. I'm Dr. Smith, the orthopedic surgeon who will be performing your hip replacement. So you can fill in the blanks. So hello, mommy. My name is Dr. Anna. I am
a joy doctor.
What are you going to do for me?
Well,
Going to make me happier?
yeah, I guess. I guess.
Okay, let's see what's next.
Ask the patient what complaints they have. Find out as much as possible about the patient's main complaint. In the example above, the patient complains of heart pain. Therefore, you should learn as many details as possible regarding the pain. For example, when it started, where exactly it is located, and how bad it is.
Okay, so
what is the main complaint?
my main complaint is that my jitteris keeps hurting. I had surgery on it a couple of years ago, and it's been bugging me ever since.
Well, where does it hurt?
Somewhere around here.
Now, like when did it start?
Right after surgery a couple of years ago, I had this quack doctor who helped me with it, and it's just never been right ever since.
Dr. Anna.
What is it like?
What is the what like?
Like, what does it feel like?
It feels like dull, sore, achy pains. Angela says, what is a jitteris? So there's an old video that Anna and I made a couple of years ago of her fixing my jitteris. I don't know what it is. It's something she came up with on the video.
I just made it up. I thought it would be funny to make it.
It's a very funny video. So if you ever get the opportunity to go back and watch it, I highly recommend it. Okay, and then what else do you ask? What is it like?
Does it move anywhere?
It does. Sometimes it hurts up here.
What?
Yeah.
Is there anything associated with it?
Sometimes it's worse after I eat hamburgers, like 12 of them.
Wow.
Yeah.
How long does it last?
Usually like 3 years at a time.
Does anything make it better or worse?
Well, like I said, when I eat lots of hamburgers, it makes it worse. And sometimes if I sleep, it's better because I can't feel it while I'm sleeping.
On the survey, it's on a scale of 1 to 10. So how bad is it on a scale of 1 to 10? When it goes up.
It's like a 9. So those are all the questions. So you ask the patient what complaints they have, find out as much as possible. So you have to ask more and more questions to get as much information as possible if you're going to assess what's going on, right?
Let's look at the medical history form from your set. It has 7 sections. In this and later sets from your subscription, we will discuss these sections step by step.
Okay, so what kind of information do they collect on the medical history form?
Like name, age, gender, occupational, and like if you're single, married, other, like widowed, divorced. And then it says social history.
And what's it asking about in the social history?
Tobacco. What's that?
Tobacco. That's smoking. So have you ever smoked or chewed tobacco?
Or drinking alcohol, or drugs, or exercise, or caffeine, or diet.
How do you rate your diet?
Yeah, a good, fair, poor. And what pets?
What pets do you have? And then what's next?
Like what type of pet?
Yeah.
There's like allergies, drugs, food, plants, or other.
And then a list of
medications taken.
You always have to tell them what medications you're taking. And then they want to know
family medical history, like what's the member, like what diseases do you have, like what's the health status and cause of death.
If they've passed. And they want to know if any blood relative has ever had any of these conditions. And they want your past medical history. How many surgeries have you had?
And then how many injuries, how many hospitalizations, how many chronic disease, like
if you have chronic disease,
or anything like other than that.
And then this part is for the physical exam. So I think that might be on a different page. So it says medical history form has 7 sections: general information, social history, allergies, medications, family medical history, patient's past medical history, and then the physical exam.
Why do hospitals ask if a patient is married,
so this
single?
Is
the purpose. Why do hospitals ask if a patient is married, single, widowed, or divorced? If something happens to the patient, for example, if they lose consciousness, doctors need to know who to contact in order to get permission for medical intervention. On average, married people tend to take fewer risks, eat better, and maintain healthier lifestyles than single people. Studies have shown that married people tend to keep regular doctor's appointments and follow doctor's recommendations more often than single people. There is also something known as the widowhood effect. Older people who have lost a spouse have an increased risk of dying themselves.
That's sad.
The purpose of a social history is to find out about a patient's lifestyle, their level of physical activity, diet, allergies, smoking habits, and alcohol consumption. Lifestyle can affect health. For example, smoking increases the risk of heart attack, stroke, and cancer.
So why do they want to know these things in the social history?
Well, because they want to see like what, like if you're eating good, and like if you're exercising good and if you have had caffeine and like if you have alcohol, like they want to see so that way they can know, like if you said you've had alcohol before, they would be like, we need to contact somebody about this. We need to like get permission.
Yeah, well, because we need to contact somebody about this and get permission. Well, it's because some of these behaviors can be bad for your health, right?
Mhm.
Yeah, like if you're consuming alcohol or tobacco or drugs, like that's not good for you. That's going to make you more sick, right?
Mhm.
So they want to know if you're doing any of those things that will make you more sick. Right. And they may need to contact somebody if you're having an issue, right? If you're doing too much of that stuff, then definitely you might need to get some help.
You may wonder why doctors ask about pets. There are a few reasons for this. First of all, having a pet can be beneficial for physical health. For example, taking a dog for a walk increases your opportunities to exercise, get outside and socialize. Regularly walking or playing with pets can decrease your blood pressure and chances of developing atherosclerotic plaque, and thus reduce the risk of heart disease. Pets are also good for mental health. Their companionship can help patients manage loneliness and depression. Unfortunately, there are some health risks too. Animal fur, saliva, feathers, and dander can cause allergies, and pets can sometimes carry harmful germs and parasites such as Toxoplasma gondii. So in order to reduce the risk of getting sick from germs pets can carry, make sure to wash your hands regularly.
I miss Mimi because she used to lower my blood pressure for sure. Remember, whenever you were sad or upset, she'd come over and she'd lay with you and snuggle.
Like if I was crying because of me doing stretching, like she'd come over here and lay on my knees.
Yeah, she would. She'd go right to the part that was sore and she'd try and love on you. And she'd let you pet her, which makes you feel better, right?
And she would even go.
Yeah.
She would try to grab on.
And you did get more exercise with her, right? Because you'd chase her around the house and drag the little string on the stick around, and she'd chase it.
It always gets stuck in the wrong, and she's like, she's running over to it.
Yeah. So yeah, pets are good. Okay. So this says check several options. Choose the questions that are relevant when taking a patient. Ooh, it's a quiz. You like quizzes.
Can I see?
Choose the questions that are relevant when taking a patient's social history. So they want you to check off the things that are important, right?
Mm-hmm.
Relevant means like it's important. It's part of what you're trying to figure out when taking a patient's social history. So is this important? Yes or no? Do you use recreational drugs?
No.
That's not an important question?
Well, you don't use it. So.
No. They're not asking if I do. They're asking. This is a quiz on the section. So we just learned, right, about the patient card and what information we need to collect when we're a doctor assessing a patient, right? And so now they're quizzing you. They're testing you to see how much you remember from what you learned. So they're asking, is it important to ask, do you use recreational drugs? Is that important information that you need to have if you're a doctor assessing a patient? Yes. Okay. Is it important to know, what is your pet's name? Do you think that's important to assessing somebody's health?
I guess because if like you're allergic to pets or something, you need to know like what the pet's name to go to make sure that so that way you know that just.
Well, it'd be important to know if they have a pet, right?
Yeah.
And it's probably important to know what kind of pet they have. But I don't think it's really important to know the pet's name, right? That doesn't really change anything, right? Do you understand?
Yeah.
Like it doesn't change anything what their name is, but it matters if they're a dog or a cat or if you have one or you don't have one.
Yeah, so I guess that would be.
Do you think it's important to know how they prefer their tea? Do they add lemon or milk to their tea?
It does.
I don't know about that one. We'll check it off, but I'm not really sure. Do you think it's important to know if they drink coffee or tea? And if they do, how often?
Yeah,
yes, definitely. Do you think it's important to know how often they exercise? Is that important to figuring out how healthy someone is?
Yeah.
Yeah. Do you think it's important to ask, do you have any pets? And if so, what kind?
Yes.
Yes. Do you think it's important to ask, do you take any medications? What type of medicines and what dosage? Yes. And do you think it's important to ask, do you tend to eat more homemade or takeout meals?
Yeah.
Why?
Because, like, if it's homemade, if it's like takeout meals, it'll probably be like McDonald's or something, because the junk food is more of a takeout meal. So
I think that's a really good point. All right, let's check it. Okay, so they say it's not important to ask how you make your tea, but it is important to ask if you drink tea or coffee. This one I'm confused about. It says it's not relevant to ask, do you take any medications, what type and dosage? Let's learn more. Choose the questions that are relevant when taking a patient's social history. Oh, social history. Okay, so that's my fault. I didn't read that clearly enough. So they're only asking about the questions that go in this first section of the form. So they only want to know questions about this first part of the chart, the social history. Social history questions include information on diet, exercise, alcohol, caffeine, smoking, recreational drugs, and pets. But the medication section is later on the form, isn't it?
Mm-hmm.
So that's why. Okay. So let's move
take
on.
a closer look at a few harmful behaviors, in particular alcohol consumption and smoking. Excessive alcohol use can lead to chronic diseases and other problems, including high blood pressure, heart disease, stroke, liver disease, digestive problems, a weakened immune system, and learning and memory problems. So it is important to screen patients for the possibility of alcohol dependence. One of the commonly used tools in identifying alcohol dependence is CAGE, a series of 4 screening questions listed below.
Okay, so it's recommended that both men and women drink no more than 1 to 2 drinks a day. Excessive alcohol use can lead to health problems. One of the commonly used tools in identifying alcohol dependence is called the CAGE test. So there's 4 screening questions. You want to read what they are?
Yeah. Have you ever felt you need to cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt guilty about drinking? And last but not least, have you ever felt you needed a drink first? First thing in the morning, eye opener, to steady your nerves or to get rid of a hangover. Each positive answer equals 1 point. A score higher than 2 points is cause for concern.
Okay, that's good to know. What's next?
Smoking history is described in the number of pack years. A single pack year is equivalent to smoking 20 cigarettes a day for a whole year. Calculating pack years helps to measure a patient's risk of developing lung cancer, cardiovascular diseases, and chronic obstructive pulmonary disease, COPD.
Where is that?
You're looking for that? It's not in here. This is showing you the way you can calculate. So there's an equation you can use to calculate how much they've smoked and how detrimental it is to their health. So you know that I used to smoke, right? But I quit because it's terrible for you and it's very unhealthy. So I would have been somewhere on this chart before many, many years ago, but I stopped and it's been 12 years. So my lungs hopefully have gotten a lot more healthy since then. And it's almost like I never did it in the first place. So should you ever start smoking? Never. It's a terrible habit and it's very hard to stop. Okay, so this is asking about the equation. Calculate the pack years for a patient that's been smoking 8 cigarettes a day for 5 years. So this is a little complex for you because this is multiplication. And we haven't learned multiplication yet, have we?
So I'll guess you have to do it.
Mm-hmm. I might get it wrong. 2. Okay. All right, and then
Our virtual patient will also fill out an ROS, Review of Symptoms questionnaire. What's that? The Review of Symptoms is a list of yes/no questions, grouped by organ system. ROS helps you get more information about a patient's health and whether there are any problems in a particular system. You will find the ROS for your virtual patient later on in the mobile app.
Okay.
Let's review what we have just learned. When taking a patient's history, follow the script. Introduce yourself. What complaints does the patient have? Learn as much as possible about the patient's complaint. Learn about the patient's background, harmful habits, for example, smoking, consuming alcohol, illegal substance abuse, lifestyle, pets, etc. ROS questionnaire.
Okay. Yay. Great job. Now we can do the next experiment, which is
Theometry. Thermometry.
Thermometry. Learn about
body temperature regulation and measurement.
Cool. All right, so we're gonna.
Are you gonna take the stuff out to do this?
Yep. So we need the case history, set of cards, therapy cards. Let's see if I can find. That's not this.
It's
That's
a
the
goniometry.
Goni. Here's the cards. Okay. Here's the forehead thermometer. Cool, cool. I remember these from when I was little. I haven't seen one of these in a very long time. Okay, so move on to the physical exam. In this box, you'll learn how to take a patient's vital signs and perform lung and heart. You don't remember how to say it? I don't remember how to say it either. Do you remember how to say it?
What?
Oscillations?
Yeah,
oscillations. Okay. Body temperature. Oh, you should read this part.
Body temperature is a balance between the production and loss of
heat.
Of heat.
So body temperature is a balance between the production of heat and the loss of heat, right?
Yeah.
So your body produces heat, correct? And your body loses heat, right?
Yeah. The normal temperature for the human body is 35 Celsius
to
37.2 Celsius.
Or
95 Fahrenheit to 98.6 Fahrenheit.
Right.
At 43 Celsius.
Or
109.4 Fahrenheit and above, cells in our body are irreversibly damaged.
That means you cannot reverse that damage. So once they get damaged, they're damaged forever.
When our temperature drops, our body's cellular metabolism drastically slows down.
Okay. Body temperature is regulated by an area of the brain called the hypothalamus, which measures the temperature of your blood. When your temperature drops or rises too drastically, the hypothalamus starts either the cooling process or the warming process. Various tumors affecting the hypothalamus can affect thermal regulation.
Oh, my turn?
Yeah, your turn.
Body temperature is one of the 4 indicators of vital functions. It can be used to indirectly judge pathological processes in the body. Medical thermometers are usually classified where they measure temperature.
Usually classified by where they measure temperature. So oral means where? What is oral? By mouth?
Yeah, by your mouth.
Ear is clearly in your ear. Auxiliary looks like it could be under your armpit.
Yes.
Rectal, you know where that is. And Frontal, I guess, would be maybe your forehead. Different countries use different temperature scales, right? Usually Celsius or Fahrenheit. These two scales use different reference points. 0 degrees on the Celsius scale is the freezing point of water. Rumor has it that 0 degrees on the Fahrenheit scale is the lowest recorded temperature of the coldest winter in Gabriel Fahrenheit's hometown, the modern-day city of Dansk.
Where is it?
Down there. So you can see water boils, absolute 0, and then all the things in between. The formula to convert from Fahrenheit to Celsius is shown above. You can always review this formula using the card in your box. So apparently there's a card, but this is a pretty complex formula, right? Because it has fractions and subtraction and yeah, it's right there.
Okay, what one is that? Can you flip that around?
Do what?
Can you flip that one around?
Flip it around. It's the same one that has the height and weight chart on the back. So this is pretty cool. They give you a little chart for height and weight. They give you a little chart with different formulas to figure things out. Choose the correct answer. The patient's temperature is 104.6 Fahrenheit. Convert this value to Celsius. We're not going to bother with that. Oh, here it tells you how this thermometer works. You want to read that one?
Yeah. No, I'll have you read it. I'll have you read it. Okay?
In this set, you'll find a forehead liquid crystal thermometer. It doesn't need batteries to work. Liquid crystal thermometers contain molecules that are extremely sensitive to temperature. At the slightest change in temperature, the molecules change their location relative to each other, and this leads to the color change that we see. So it's got a polyester film, a white graphic print, a black graphic print, liquid crystal inks, a black backing, an adhesive, and a release liner. You read that part.
Make sure your forehead is dry and clean. Stand in front of the mirror or turn on the front camera on your phone. Take the strip by the ends and apply it to the middle of your forehead. Hold it in the position for 15 seconds.
Okay, so you are dry and clean. So let's see. Ready?
Okay.
And count 15 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Hold on, let me get this to refocus. There we go. Pete says it's like a mood ring for your forehead. That's very true.
It's done. It's been 15
Yep,
seconds.
let me see. I'm looking to see what it says. Start timer. Oh, there's a timer. We didn't use the timer. That's okay. All right. Without removing the strip from your forehead, look at what temperature is showing. If it's green, this means your body temperature is in normal range. Red means it's running high. If it's blue and green, then the average value between them represents your body temperature. If all three colors have appeared, brown, blue, and green, then the green value is correct. Let's see. Oh, you have some. Oh, I'm like, where's my phone? It's right in front of us. I'm reading off of it. I'm just trying to get some light on there to see. You guys are too far away to see, huh? Baby,
Yes.
come look at this. Make sure we're reading it properly. It looks like she's blue, mostly.
Is this one?
Well, it says which colors have appeared. What colors do you see?
I see blue and this kind of orangish or brown.
Green, brown.
Mm-hmm.
If there's no green, the temperature hasn't finished measuring your body temperature yet. You have no body temperature.
Whoa.
Is it green?
No, all I see is blue and yellow. Should I try it on me and you can see?
Yeah.
Okay. Let's let it
Can I see it real quick?
Angela says you left it on for too long. Maybe. But it says to keep it on your head while looking at it. Okay, let's see what mine says. Ready?
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So it looks like there's different colors. There's like 2 blues, 1 green, and 1 like brown.
So it says if blue, brown, and green show up, then the green value is correct. What is the green value?
98.6.
So I have a normal temperature.
Okay.
Cool. All right. So we learned how to take temperature. It works, yeah. Now we can do measuring tape. What is BMI and why WHR is better? So there's a measuring tape in here. That would be this. We've done this before, right?
Yeah.
Let's start this experiment. We need the measuring tape and the set of therapy cards, probably this chart right there.
Okay.
Okay. Can you read that?
We'll have you read half, I'll read half, okay?
Well, I'll read the next page. Let's take turns.
You have probably heard about the connections between obesity.
Do
Obesity.
you know what obesity is? It's when you're very overweight, like I am.
Stop.
It's true. Keep going. Obesity.
Between obesity and cardiovascular diseases. So it's like cardiovascular diseases are like diseases that are in your cardiovascular system.
Yeah.
Like something that happens like
In your heart.
yeah. Something that happens.
And what else? Not just that, but also
Certain types of heart
coronary heart disease.
coronary heart disease, diabetes, and certain types of cancer. Despite common misconceptions, weight-related health problems are not exclusive to being overweight. Being underweight is also associated with health risks. The list of diseases associated with a body weight deficit includes respiratory diseases, mental disorders, and neurological diseases.
Mm-hmm. So up here it shows you like if you have a poor diet and being overweight and abdominal obesity, what the different things are that it can cause, and being underweight, what are the different things that it can cause. And I am considered obese. I have a condition called PCOS, which makes it very easy to gain weight and very difficult to lose it. I also went through a period after my son was born 23 years ago of dealing with depression and the very tumultuous onset of my anxiety disorder and panic attacks. And so I had medication for that for a while that caused me to gain weight, and I've never been able to lose it since. And that's just life, like some people have reasons why. It's something to keep in mind. When you see someone who's overweight, don't always assume that it's because they're just sitting around eating junk all day. That's not always the case.
I am 6, Christina.
Okay, so this is talking about human adipose tissue. Animals store energy in their bodies in adipose tissue. In addition to storing energy, fat is involved in hormonal regulation and the work of the immune system. Thus, having too much or too little tissue affects how the body functions. Methods of assessing a patient's weight include measuring body mass index, or BMI. Are you bored, or do you need a deep breath? Are you bored because you're yawning, or do you need a deep breath? Neither. And waist circumference. Do you know what waist circumference is? The circumference of something is the measurement around it, right?
Can I measure you?
Let's measure you. In fact, BMI is an assessment of the relationship between the patient's weight and height. BMI can be calculated using these formulas, and I think you have those same formulas on your little card.
Yes, BMI equals mass, kilograms, and height.
What is mass in kilograms? That's a measurement of
height.
Kilograms would be weight, right? And then this is the measurement of height. So they look at your weight and your height to determine your body mass index. And then they look at you on the chart and see where you fall. Are you obese, overweight, normal, or underweight? So you have a chart. You actually have, here's a fun fact. AMCers have their own growth chart because most of the time they run short and underweight for their age. This is due to the fact that, like you can see, Anna has very little muscle tissue, and muscle tissue has weight. So if you're lacking muscle tissue, you're not going to weigh the same as another 6-year-old with muscle tissue. And so they always tend to be on the small side. And rather than the doctors being concerned about it because it's typical for arthrogryposis, they actually have a separate growth chart so that you can see not how you compare to your average child of the same age, but how you compare to other AMCers of the same age.
How tall are you?
I am 5'5". Okay.
No, in inches.
Oh, I don't know. I'd have to find out how many inches that is.
It only goes up to 80.
Only goes up to 80 inches?
Yeah.
Okay, it says, unfortunately, the BMI assessment, which was developed at the end of the 19th century, does not assess the distribution of muscle mass. Thus, athletes with developed muscles often have BMIs indicating pre-obesity or even obesity. Doctors have critiqued the BMI system for this very reason. Another tool to assess body composition is the waist to hip circumference ratio. So circumference is what again? The measurement around something. So you look at the measurement around your waist and the measurement around your hips, and you figure out the ratio, and you can estimate the amount of fat located in the abdominal cavity and around the vital organs. The more abdominal fat, the higher the risk of developing chronic disease.
So can you please push me back? I'm scooting forward.
Yeah. Am I going to measure your waist?
Yeah.
Can we do it right now?
Yeah.
Let's see. Ready?
Okay.
You got a teeny tiny itty bitty waist, don't you?
Yeah.
Let's see.
4.
Where's the 50? 53. What is that? Centimeters? Let's do inches. Ready? 21 inches.
21.
21 inches. I think that means your waist is perfectly sized
Yeah.
for your little body. And it shows you how to position the measuring tape. And it shows you how to calculate to figure out if there's a problem or not. What's next?
Ooh, pulse oximetry.
Pulse oximetry. Learn how to measure blood oxygenation and heart rate. Do you guys have one of these? This is a really useful thing to have in your home right now, especially with the things that are going around. And they're very inexpensive. You can get one on Amazon for like $5. Highly recommend everyone have one of these in their home, where their thermometer is, right where you keep your medical supplies.
What's the magic number? That you need to know when you need to take it seriously for the oxygen.
Oh, I don't remember exactly, but it's good to know. Wait a minute. We need AAA batteries, baby.
AAA?
Yeah. Sorry. Double A's aren't going to fit. Sarah says we use them at work. Jersey says, yes, we bought one. Very good. I bought one when the pandemic started. Smart. Yes.
Just so you didn't have to go out, probably.
Yes, I do have one, says Hillary. Yay. It's a good thing. Good thing to have right now. Because if you get sick, you're going to want to keep an eye on the numbers that show up on this thing. And we actually have another, we actually have one other than this one. Thank you. All right, let's put the batteries in it this way and this way. You've used this before, correct?
Yes.
Our other one, right? Not this one. Okay, let's see what they say. Learn how to measure blood oxygenation and heart rate.
Of course, I think we need the stack of cards.
Okay, we don't need this one anymore. So, let me read that.
The main carrier of oxygen in the blood, is hemoglobin.
Hemoglobin.
Yeah, hemoglobin. Hemoglobin without oxygen is called deoxygenated hemoglobin.
Good job.
Its hemoglobin with oxygen is called oxygenated hemoglobin.
So deoxygenated hemoglobin and oxygenated hemoglobin.
Yeah.
A pulse oximetry. Why can't I say that? A pulse ox measures the blood content of oxygenated hemoglobin. In other words, it measures the blood oxygenation or saturation. If the saturation level is low, tissues receive too little oxygen and cells experience severe stress. Look at that stressed out cell. Thus, oxygenation is one of the vital signs evaluated during a physical exam. Go ahead.
Pulse oximetry uses light to measure oxygen saturation. Light is emitted from the source on one side of the pulse oximeter.
See the light?
Mhm. And travels to the detector on the other side. When a finger is placed between the light source and the receiver, some light will pass through the finger and some will be absorbed by it.
Mm-hmm.
Can I try it on yours?
Yeah, sure. Let's finish reading about it. The amount of light that gets absorbed depends on the length of the light's path through the light absorbing substance and the concentration of that substance. So hemoglobin inside your finger absorbs light. Thus, the more hemoglobin in your finger or in the blood, the more light will be absorbed. The blood vessels that the light passes through can be narrow or wide. The wider the vessels, the longer the light's path through the hemoglobin and the more light is absorbed. So that's how it measures.
And do you see those little lines in there in the box?
Mm-hmm.
Like the little things in between the styrofoam?
Mm-hmm.
That's down there. That's there's some stuff hiding in there.
Yeah, that's for the next experiment.
Yeah.
Okay, so the pulse oximeter measures the absorption ratio of red to infrared light, calculates the blood oxygen level. Another vital sign that it measures is the heart rate or the pulse, which is the number of.
Can I go ahead and write some stuff down on this or what?
No, we're gonna read this stuff first. I don't think we're writing anything yet. What is the heart rate or pulse?
Well, the pulse is like by your palm.
But what is it? What does that mean? That thump thump thump? Do you know?
It's your blood.
It's the
number of times your heart beats per minute.
Yeah, it's the number of times your heart beats per minute. And heart rate varies from person to person, right? Depends on age, gender, fitness level, and overall lifestyle. So how fast your heart is beating is an important indicator of overall heart health. Look at reference values for each age group. So if you're 20 years old, then your target heart rate is
100 to 170.
Mm-hmm. And if you're 45 years old, which I almost am, your heart rate should be
88 to 149.
Mm-hmm. Oh, look, they're showing you how to put it on the finger. They're putting it on his middle finger, and then they're resting. Do you want to put it on my middle finger? Push the button. Okay. There we go. Let's see what happens. It says you can use the index finger or the middle finger. Hold the finger motionlessly in the pulse ox for at least 1 minute. I'm going to start the timer.
It's counting, just counting up.
$40 seconds. Nope, don't bump it. Don't bump it. I'm supposed to be holding it still. If you bump it, it's going to mess it up. 30 seconds. Sharon says, this is great. I love this lesson. It's pretty neat. What do you think? Are you enjoying it?
Yeah.
Are you learning stuff? Is it interesting to you?
Yeah.
Yeah. Angela says, this sounds similar to all my doctor visits. Great job, Anna.
Cool.
Okay, 5-4. 3, 2, 1. All right. Time is up. Write down the maximum value that remains unchanged for 5 seconds. So I have a top number, which is
98.
98. And my bottom number is
83 right now.
84, 85, 87, 88, 90. Maybe I shouldn't look at it. When I look at it, it goes up. I look away, it drops down. I look at it, it goes up. That must be my heart rate. So my oxygen is at 98, probably because I've been talking a lot. And my heart rate is fluctuating between 85 and 95. Is that good?
Yeah.
Is it?
Yeah.
Where's your chart? You have a chart for that, doctor? So you can check? Maybe we need to go back to the chart. Here. Look at this chart on the screen. So it says for my age, it should be between...
It should be between 88 and 149. Can I test it again for real quick?
Test it again. It was between 85. It was fluctuating between 85 and 95. So that's a pretty good heart rate. Can we test yours?
Yeah.
We don't
sure.
have a chart to make sure
Let's
what
test
it
on my
should be,
left
but
one,
let's
okay?
see what it is.
Can I test on my left one?
Sure. Okay, ready?
Okay.
We're going to put on your middle finger or your index finger?
Middle.
Stick your finger in there. Jump, jump. Hold your hand really
Can
still.
I click it?
Nope. Keep it very still. Do you feel that little bump on the bottom? Is your finger on top of the bump?
Yeah.
Yes? Okay. Is it going to read? Uh-oh. Doesn't want to read you. Might have to hold it up here. It doesn't want to read her. Maybe her finger's too little. Let's try your other finger. It's not liking this finger. Or it could be because your fingers are sweaty.
Oh yeah.
We'll try wiping it off real quick. Her finger might be too small. Yeah, it might be too small.
It might be too small or it might be too
Liz says
sweaty.
your finger's too small. She's got itty bitty teeny tiny fingers. Look at these little fingers.
Can you wipe my hand off?
Yes.
Sure.
We'll try one more time, and if it doesn't work, then it's just because we need a little baby pulse ox. We need a little tiny finger pulse ox. I think they make pulse ox just for children. Do they? We should find one, babe.
What?
We should look on Amazon, see if they make a pulse ox just for kids.
Can you go get the other one?
You want to try the other one?
Yeah.
You could ask. Do you want to go get it?
Oh yeah, they do.
Oh, they do. See, they make them just for kids. We'll get you a kids one. How's that?
Yeah.
Look at what the next experiment is.
Goniometry.
You know all about this already.
Yeah.
How do you know about this already?
Well, I know about it because if you're doing it with your leg and you're measuring like all the way straight, that would be 0. And if you're measuring really bent, then that would be either 90 or it could go up to 180.
But how do you know this? Where did you do this from? Where did you learn about a goniometer and how to use it?
I think from Mr. Dan.
From Mr. Dan, yeah, from physical therapy. Because this is a big part of measuring arthrogryposis limbs, huh? So this is a goniometer.
What is that thing?
It's just paper. We've been using one of these for years. It looks like a measuring tool. It has different degrees of measurement on it. While studying medicine and science in general, you will learn a lot of Greek and Latin words. A goniometer, from the Greek gonio, angle and meter, measure, is a device used in medicine to measure the range of motion in joints. See? That's one of the biggest things affected
Can I say it real quick?
from your arthrogryposis, right?
Mm-hmm.
The range of motion in your joints.
Yeah.
Even though general practitioners rarely use this instrument, general practitioners means like your regular doctor.
Yeah.
Your regular doctor has never measured your legs, have they? It's always been your physical therapist or your surgeon, your orthopedic surgeon. We've decided to include it in our therapy box to better demonstrate what joint range of motion is. So how cool that they included this thing that isn't even like a typical general doctor tool.
So this is at 90. Can you show them this is 90?
Yeah, this is 90.
That's 90 degrees,
90
exactly.
degrees. Mm-hmm.
And then 0, as I was talking about, would be,
Completely straight, right?
yeah.
Can you read this part so we can tell them about the different parts of it? That's 0. Yeah,
Can you show them?
completely straight.
That's 0.
So read what does that say?
A goniometer consists of 2 connected ruler-like arms.
Mm-hmm.
One stationary and one moving.
Mm-hmm. Keep going.
There is a circular protractor where they meet.
Circular protractor. So this is the body, the circular protractor with all the angle measurements on it. There's a stationary arm and there's a moving arm. It says the tool is often used in sports to assess the level of flexibility. Greater range of motion indicates greater joint health. Here are reference values for joint range of motion in different body parts. So it shows that shoulder extension, a typical range of motion is like 0 to 60 degrees. What's your shoulder extension? $20? Did I do that right? Elbow flexion, normal range of motion is
0 to 150.
150. So she actually had surgery on her elbows. So if you didn't know, when Anna was born, her elbows were
Stuck straight.
They were completely straight, locked, completely straight, 0. And she had elbow release surgery on her right arm when she was 1 year old and on her left arm when she was 2 years old. And that gave her flexion.
Yeah.
Yeah.
So
Range of motion.
let's measure how far bent it can go.
How far bent it goes? Okay. This would be, what is that called? How far bent it goes is called
Flexion.
flexion. That's right. And how far straight it goes is called
Extension.
extension. Yes.
What is that?
So your elbow is doing about 120 degrees. Pretty good. It's within acceptable range.
Yeah.
And then they have wrist flexion extension, which you don't really have any, right?
Can I measure the flexion though?
The flexion of your wrist?
Yeah. How
Yeah.
far flex it? That would be
70. And then knee flexion, which we measure almost on a daily basis, right? Because we
She's
just
probably
stretch
like-
your knees.
that was probably like 80, 90.
And so when Anna was born, her legs were stuck in flexion, especially her left leg. And so she had surgery with Dr. Feldman. Some of you guys may have seen that video we reposted a few days ago about her surgery with Dr. Feldman. And Dr. Feldman straightened her legs out so that she would be able to walk. But we wanted to make sure they could both flex and extend, right? We wanted to keep them both bending and straight. So every night she wears these long leg braces called KFOs. They are knee, ankle, foot orthotics. And they go from her feet to her thighs. And they stretch her legs into flexion. And we try to get her, about the best we get these days is 110 degrees, which would be
That's
right here. So this is as far as Anna's legs bend. And so she spends about an hour every night or every other night in 110 degrees of flexion. And then after that hour, we go in and straighten them. so they can spend the rest of the night in extension. And that's how we keep her legs bending and straightening very well. Huh?
Mm-hmm. Can I measure your ones?
You want to measure my
elbow flexion?
my elbow flexion? Sure. I'll hold it down. Hold it down really far. You ready?
Yeah.
Okay. Measure it.
Can you lift it up towards me more? No, that your elbow.
Lift my elbow towards you more.
No, your hands kind of.
Like this?
No, so it's like strapping like that.
Like this? I can't do that.
It's like,
Here, you got to put it up this way. Okay, so how do you measure? Where does that one go?
so the middle line should go about,
Right down the middle of my arm, right?
yeah.
Okay, can you hold that part? And then how do I do this part?
You just keep moving right there.
The middle line should go what?
In the middle of your arm.
In the middle of my arm.
So that would be
And then you look at where the arrow is pointing.
120.
120. That's the same as you.
Yeah.
We've got the same amount of elbow flexion.
Whoa, cool.
What's the next experiment?
Ooh, I love this part. You read it.
Right?
So-
Auscultation
Auscultation of the heart.
of the heart. So what does it say?
Does the heart skip the beat? Listen to heart sounds.
Listen to heart sounds. Cool. Let's see. So we need
Those hands.
the gloves.
Oh,
Got
yeah.
some gloves here.
Have hands on.
And the what?
The set of cards and the stethoscope.
And the
Ta-
tonometer.
Tonometer and stethoscope.
Well, now we get to pull stuff out of the bag. There's a stethoscope.
I'm
Look
gonna.
at- Some blood pressure. Cool. Very cool. I know. I'm getting your stethoscope.
And then the reference cards. Okay, swipe.
I think I have to put I think some assembly is required. It's an IKEA stethoscope.
Can I swipe one page?
Yes, you can swipe. You want to read while I'm putting this together?
Yeah.
Okay.
You can also use a stethoscope to listen to a patient's heartbeat. A heartbeat is a two-part pumping action. During the first part, called the diastole?
Distal?
Distal?
Can't see. Is there an A in there?
Yes. It's diastole.
You ask your friends for help.
Can you spell this out for us phonetically so we know how to pronounce it? And when I see it, it's spelled diastole.
See, Pete says
Distal?
distal.
Distal. Yeah, distal. Blood collects in the upper chambers of the heart. The arteria, right?
The atria.
Atria. Then the heart's pacemaker sends an electrical signal that causes the atria to contract. Hmm? Oh,
It's working.
cool. That's why it's real.
What else?
This contraction pushes blood through the heart valves into lower chambers, the ventricles.
The ventricles. Yeah.
Can I listen to my heartbeat?
Yeah. Let's see what they want us to do. The second part, called the systole, begins when the ventricles are full of blood. The electrical signal from another pacemaker makes them contract, and the blood rushes out. From the right side, blood goes into the lungs to pick up oxygen. From the left, Oxygen-rich blood flows through the aorta to the heart and other parts of the body. The most obvious heart sounds are the first and second sounds. S1, the systole sound, S2, the distal sound. The S1 sound is created when the heart valves between the atria and ventricles shut. And the S2 sound is created at the end when the ventricles begin to relax, and a backflow of blood causes the valves between the left atria and aorta and the right atria and pulmonary aorta to snap shut. So that's why you hear like you hear two sounds. It's not just bump, bump, bump. It's like bump, 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 right?
Mm-hmm.
So there's two different sounds happening. There's some other sounds that are harder to hear. So place the ear tips in your ears and twist them until they point slightly towards your nose. Do what? Huh? This is metal. How do I twist it? Okay. I'm not sure. Ah, okay. Got it.
It's just really hard.
Yeah. All right. Let's carefully, let me see the other side. How does that feel?
Good.
Okay. All right. Hold the chest piece. Put your thumb under the tube to keep it from rubbing. Place against bare skin. Ready?
Mm-hmm.
Sit up straight. Do you want me to do mine or yours?
Mine first.
Gotta turn this way. Can you hear it? What's it sound like?
Sounds like weird.
Sounds like weird. Can you make the sound? No? You want to hear mine?
Yeah.
Tell me if mine is faster or slower.
Yours is faster.
Yeah? What's it sound like?
Sounds like what you told me.
Can I try?
Yeah.
I'm going to hear the difference between mine and yours.
Let's do mine first. It's kind of hard to hear, but
Bum, 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 bum. Let's see what yours sounds like. Bum, 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 bum. They sound about the same to me. They sound about the same speed. That's interesting. It gives you different areas to check and a mnemonic rule to memorize how to check the different areas. Make apple pie to eat. So you check the mitral, aortic, pulmonic, tricuspid, and Erb's point. Listen to the frequency, type, and rhythm of the heart sounds. Are they accompanied by noises like rustling or clicks? Cool, huh? Did you hear the heartbeat?
yeah.
What's next?
That other thing. The blood pressure.
Blood pressure. You want to measure some blood pressure?
Yeah. We need the blood pressure thing in the cuff thing.
Okay. What does that say?
So the red is the arteries and the blue is the veins. It says. When your heart beats, it pumps blood through your blood vessels, delivering oxygen, whoa, that's giant, and energy all over your body. As blood moves around your body, it puts pressure on the walls of the vessels. The strength of this pressure is what is known as blood pressure. Think of the heart as a pump and the vessels as pipes. Thus, blood pressure is a way to measure the performance of the pump in the pipes.
I gotta figure out how this goes together.
Can I let you read? Can I let you read that? Is it
Um,
okay if you read it once you're done with that?
Yeah, I guess I have to figure out. I don't know if this goes in a particular side. They don't really say.
No.
Do they provide? Let me see if they provide some instructions for putting this together. Oh, here we go. Yes. Okay. So, pressure gauge. That's the pressure gauge.
Mm-hmm.
See?
It's like a little clock.
Yeah. It's like a tire pressure gauge.
Yeah.
And the bulb or the air pump
Mhm.
goes in this side. Wow. And then you also use the stethoscope. So the four parts of a, can you say that? Sphygmomanometer.
Sphygmomanometer.
Uh-huh. I'm looking for help, but there isn't any. Sphygmomanometer. Try it again.
Sphygmomanometer?
S-P-H-Y-G. Sphygmomanometer. Sphygmomanometer. Isn't it just a blood pressure cuff? Sphygmometer? Sphygmomanometer. Anna, try Jen's.
Sphygmomanometer.
Pete says sphygno something. It's a blood pressure.
Sphygmomanometer. I don't know.
Phenomena.
Yeah,
Too
many syllables.
Too many syllables. The thingy that checks the blood pressure.
The too many syllables that checks the blood pressure. An inflatable cuff, that's what it is.
An inflatable cuff, that's right. Okay. Let's see. When the cuff is inflated using the bulb, its pressure cuts off the patient's blood flow, and their pulse sounds cannot be heard through the stethoscope. When the air is released from the cuff and the pressure in the cuff weakens, the first wave of blood passes through the artery, still squeezed by the cuff under immense pressure. And with the help of a stethoscope, you can catch the pulsating sounds, the sounds of pumping blood. The pressure at which the sound is audible for the first time is the systolic pressure. I always wondered how they did that. Wow, now we know. That's how they pick the number. It's when they hear the blood rushing through for the first time.
Okay, it's sphygmomanometer.
Sphygmomanometer.
Yeah.
As the cuff deflates, the pressure drops, the blood begins to flow easily, and the sounds of pumping blood fade. The pressure at which the last pumping sound is heard is the diastolic pressure. Okay, that makes sense to me. Can
I try it on you?
You might have to, because I think this is way too big for your arm. Remember at Dr. Feldman's office, they have to put a baby cuff on you, right? A little kid, like a little children's blood pressure cuff. So this is an adult cuff. And it says right here to put the mark on the artery, right?
Mark.
Artery mark, see it?
Mm-hmm.
So I'm going to go like this.
But it's going to be the other way. Oh, no, big it.
Yeah, it goes like this. I have a really big arm. Her arm is way too small. Yes, we would need a children's cuff for her arm. And I often wonder how well her arm even produces a blood pressure measurement because of the lack of muscle and everything, like if it affects the measurement. Okay. All right, I've got it on, Doc. So now
we have to squeeze this thing.
Well, first you have to put on your stethoscope so you can listen for the blood sounds. Ready?
I'm going to have you do the stethoscope.
And the stethoscope, I know from experience, goes up in here. Can you hear anything? And then we squeeze. Let me squeeze?
Yeah.
Are you going to squeeze it?
Yeah, I'll have you squeeze.
It's hard to squeeze, huh? Here it goes. Tell me when you stop hearing sounds. Is it done yet? Do you hear anything? Do you hear anything? Do you hear anything? Do you hear anything?
It stopped.
It stopped?
Wait.
Can you hear it? I can feel my blood pressure in my arm.
Debbie says that cuff is upside down, I think.
Nuh-uh.
I don't know. No idea.
Because the tubes have to, because this is the artery mark, right? Always make sure your arm is rested at heart level. Well, can't really do that here. Do you want me to listen? Yeah. Let me see if I can hear it. Babe.
What? Do you need me?
Yeah. I can't put the things in my ears because I can't bend my arm up. Thank you.
Okay, can I try to push it with my elbow?
What do you want to do?
Try to push it.
Try to squeeze it?
Yeah.
Sure.
I'll try to do it.
Okay. All right, I can hear stuff now. You did it. You did it. You're doing it. Yay.
I'm just using my elbow.
Good job.
Can you hear?
Keep pumping. Keep going. People are saying you got to get it up to 180. Look at her go. Good job, baby. Keep going.
It's not going.
Can we get it?
Yeah.
Oh, it did. It got really quiet at 180.
Can you loosen it all the way so
Let me listen.
Can I try to do that? Listening or no?
Hold on.
And it's going back like it's loosening up.
Huh. I would say it's something like 130/70
Can you
based on
can
what
I-
I'm hearing. Woo! That was tight. My goodness. I think my arm needs a break. Wow. Maybe we can check Aaron's blood pressure after the live.
Yeah,
Yeah.
I think we
That's
should.
pretty cool though, huh?
Mhm.
Now we know how to check blood pressure. Very cool.
I think we should start writing down too, so that way we know what's going on.
That's pretty good. Oh, good. That's good. It means my medicine is working. I actually do have high blood pressure. I've had it since I was pregnant with my daughter, which was my first daughter. 26 years ago now, they diagnosed me, and I'm on the lowest dose of lisinopril, the 10 milligrams. So it regulates me every day, keeps it from getting too high. Nice.
The lungs.
I
What is
think
this?
we're now at an hour and a half, so we should probably say goodnight to everybody. But we'll have to keep playing with this kit. There's still some stuff in here. Look at
What's that?
this. Is a lanyard, a badge holder, so you can have a badge, right?
Oh yeah.
So your doctor badge. And there are some rings for putting your cards on, so you can keep your cards together. So we'll have to do that.
Oh yeah.
Here's the badge. Look. MEL Hospital Trainee. How fun. It's a pretty cool kit, huh?
Yeah. Can I do it? Can I do it with Aaron?
Yeah, you can do it with Aaron while I make dinner. We need to go make some tacos, and then we need to go watch This Is Us.
Yeah.
Sound like a good plan?
Yeah.
Sound like a plan, Stan?
Yeah.
All right.
How
All
do
right, guys.
Do you turn the knob to make this loosen?
Yeah, you turn the little knob, and it
Which
lets all
way?
the air out.
This way?
That way. Yep. Righty tighty, lefty loosey. Thank you guys for hanging out with us. This was pretty cool. It's a very neat little kit to learn all these different medical. What did you learn
Yeah.
today?
I learned about blood pressure
Mm-hmm.
with this thingy.
What else did you learn?
I learned about I learned about the heart.
Mm-hmm.
I learned about measuring around. I learned about goniometry.
Mm-hmm.
I learned about gloves because there's gloves out.
You learned how the pulse oximeter works.
Mhm.
That's cool. And
The forehead thing.
the forehead thermometer, yes. Learned how that works. Very cool.
Can you pump that out even with no one in there?
Huh?
Can you?
Oh, pump it up even with no one in there? No, I don't think it works that way. All right. Good night, you guys. Have a good night. If you're watching This Is Us, have a good watch. And we will see you guys tomorrow. Bye.
Bye, everybody. Do.
Do.